PC didn't make it. As most of you know, we came that close, that close. And my daughter had this bumper sticker all made out and ready, which said, "My mom cured the incurable cancer." But she's a bit of a smart ass. I don't know where she gets it from, not my side of the family. But we didn't make it, and I'm bummed out. I will miss my husband every day for the rest of my life. But I want to tell you something. I am not soured on the technology of transplants. I would still recommend that if you have aggressive disease and you've exhausted your therapy options and you're looking at going gently into that good night, don't do it. Don't go gently into that good night. Fight. Fight for your life. You have a right to fight for it, and you're right to fight for it. And a transplant is very much an option for people who have aggressive disease, passed through most of their therapy options, and now looking at writing out their will and last testament, or making one more fight to stay alive. I think it's really worth it, and something that I hope we will progress. The Europeans have what they call now a consensus agreement that was published, which said if you have 17p deletions and excessive thing, progressive disease, it is very appropriate to consider a transplant in your very first remission, because your first remission is going to be your best. You're not likely to get a second good remission. So it's a very important document, this consensus document that was published by the European community, and I strongly advise US and Canadian doctors to get their hats together, step up to the plate, exercise leadership, and give us a similar consensus document. I hope you push for it. New partnership, and you might feel you're out of your weight class. I'm not saying our doctors are fat. In fact, they're not. Every one of them is slender. But sometimes you do feel like you are outclassed, and that it's hard to fight this battle that is not quite even-handed. But I want to tell you it can be done. And it is important that you do it, because it's in your advantage to have a doctor that listens to you. But it's equally important in the doctor's case, I think, for them to have a teachable patient, a motivated student, and one who is willing to be your partner. They're not trying to usurp your prerogatives. We are not trying to step into your turf. But surely it is obvious we have our lives riding on this. We have more skin in this game than anyone else, not even the doctor. For you, we are a patient. For us, it's our husbands, our wives, our lives. So we have more skin in this game, and there is no question on that. I'll give you one anecdote that got me steamed. The patient went to the doctor. She was a CLL group member, and she had heard all about fish. This is in America. And the woman went to the doctor and said, I would like to have this fish test because blah, blah, blah. And she had all the articles to point to, not my articles, the professional articles. The doctor heard her for about, I don't know, a minute or so. Then he gets up, took off his white jacket, came around the examination table and draped the jacket around her shoulders and said, we are playing role-playing, I see, and you want to play doctor, so you should wear the jacket. Now, that's a little condescending, wouldn't you say? And if I was that patient, I would have voted with my feet and got me a new doctor. It's time to remember, you are the consumer. You are paying these bills. You are the consumer, you are the taxpayer, you are the owner of CLL. You need to get yourself an owner's manual for CLL. You don't buy a car if they don't give you an owner's manual. If they tell you, this is a terrific Porsche, it's going to do terrific. But you know what? You're too stupid to figure out the owner's manual, so you just come back to the dealer when you want service, but we don't give you an owner's manual. You wouldn't buy that car, would you? So how is it you buy it that you can't have a CLL owner's manual? Okay, you need an owner's manual. You need to figure out what this thing is. You have 15 minutes, 15 minutes in the doctor's office. If you go in unprepared, you're asking for trouble. And you're wasting the doctor's time, and you're wasting your own time. Be prepared. Get your questions, get your ducks in a row. Figure out what you want to ask, get all your facts together. And by the way, respect cuts both ways. If you go in and say, doctor, I saw this diet on Oprah, and it's wheatgrass diet, and you eat it, and your cancer is cured. What do you think? Can I do that? Well, don't expect to get too much respect after that. You are judged by the facts that you buy. So if you go in with nonsense a couple of times, waste his time by not knowing what the hell you're talking about, people are human beings. They're going to judge you by what you say. And impressions make a long-lasting thing. And they're going to judge you by the kind of nonsense you spout if you're not careful. So make sure you know what you want to say. Make sure what you want to ask. Get your facts. And do some work before you go in. Do the work before you go in, not after the fact. That's very important. The devil is in the details, and watch out for the snake oil. These are very important criteria. Buyer beware is more important now than it has ever been. But after all this stuff, there's the reality check, okay? Just so that we don't forget what the reality is. CLL is an incurable cancer. And what you don't know can kill you. What your oncologist doesn't know can kill you even faster, okay? So your ignorance is bad, but your oncologist's ignorance can be deadly. But at the same time, I really want to stress a point. Patients come in and they are pissed at their doctor for some reason or the other. And as I just said, you're the consumer, fire the gentleman. And I was going to say something else, not a gentleman, but never mind. And get on with your life. But very often, the reality is you may be living in a community that's a rural community, and there's one oncologist, okay? And what you're going to do? You fire the guy, there's no one else to go to. So you've got to be pragmatic. Don't burn your bridges. You need a willing and able healthcare team behind you as you face this monster. So pragmatism is the name of the day. You fight the battles you need to fight. You save the bullets you need to save. You don't burn any bridges that you will need tomorrow. Okay? So these are important things to remember. It's all good and nice for me to go rah, 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 and go get rid of these bastards. It doesn't work. Very often that's the only bastard in town, And you got to go back to him. So treat him with kid gloves. And as they say, hey, honey gets more flies or whatever, and maybe he likes flies. Who knows? Okay, let's talk about clinical trials, my pet subject. Everybody who was up here complained about how terrible, not complained, but were chagrined, mortified, depressed, whatever, about the recruitment rate in clinical trials. And it is terrible. If you want a cure for CLL, let me put it to you bluntly. Only way we are ever going to get a cure for CLL is by people participating in clinical trials. Mice and petri dishes, glassware, go only so far. We aren't going to get a cure unless you guys step up to the plate and volunteer for clinical trials. That's as simple as it gets. You know what the recruitment rate for clinical trials is in the United States? 5% of adults would even consider a clinical trial. Much higher rates in pediatric oncology. Kids volunteer for clinical trials, or their patients volunteer them for clinical trials. But when it comes to adults, very few people participate. So the question comes up, why is this happening? Well, there are many reasons. There are many roadblocks why patients don't participate. I'll give you one that may not sound all that important, but I think it's important because it's at the crux of the whole problem. And it's called attitude of the system. I did a little survey once. I took Blood, the industry prestige journal for CLL, and I looked at all the papers, recent papers that were published that reported the results of clinical trials. And I flipped through all the pages, went right to the end, where they give their acknowledgments. And they are very, very proper. They thank their colleagues. They thank their institutions. They thank the sponsors that funded the clinical trial. They even thank their secretaries for typing up the manuscript. Less than 3% of the papers thank the patients who participated in those clinical trials. That attitude sucks, in my opinion, big time.